And we are back here at our annual community stream event. I'm your host, Kimberly Ewing, and today, right now, we have Corinne Amezcua from Public Health. Corinne, welcome.
Thank you for having me.
Now, first of all, being in public health, a little bit of your role. What is your role there at Public Health? And we'll talk about what it is to be in public health here in the community.
Yeah, I am the Alcohol and Other Drug Prevention Coordinator and Suicide Prevention Coordinator with Nevada County Public Health, and I work as part of our health and wellness team.
Wow. Okay, let's unpack a little bit of that. First of all, the first part was drug and alcohol.
Yep, alcohol and other drug prevention.
Okay, tell us what that means for you as a role model and with public health.
Yeah, so with public health, I coordinate a lot of our youth programs with our Friday Night Live coordination within Nevada County and our contract with Bright Futures for Youth to provide Friday Night Live, Club Live, and Friday Night Live Kids programming to elementary schools, middle schools, and high schools. I also have a student wellness and affirmation group at Silver Springs High School and do other types of trainings or educational opportunities.
Wow. So again, the common theme is children so far. Tell us a little bit about why that's so important. I'm a huge fan of Bright Futures for Youth as well. Why do you feel like now more than ever that's important to have those outlets for kids?
It's important for kids to have a safe space to go to, a community, a support system, the connectedness piece of being in a group and learning life skills, learning prevention strategies, learning about each other and having self-awareness, self-moderation, and learning about societal issues. We work with our tobacco education program and the 2P program as well to do tobacco education, vaping education, and tobacco programming. So we really work on collaborating to give our students the best education and information and possibilities and opportunities to really make some healthy choices.
And it's so important. I worked at the County Office of Education where TUPE was involved, and how kids are the advocates, that they become the speakers and the mentors, which I think is really a valuable way of connecting with kids that are maybe having some issues with vaping or whatever, and to have kids speaking to kids, that's so much more almost effective, wouldn't you say?
It is. Having that peer-to-peer mentoring process and learning from other kids and other students has a little bit more impact than hearing from me sometimes as an adult. And me being maybe a little out of touch with what they're going through. So having someone a little bit more in the know is super helpful.
I know, but yet you're coaching them and instructing them so that they do it in a safe way. Then the second part of what your title was what?
Suicide Prevention Coordinator.
Oof, okay. Suicide Prevention Coordinator. These are really hard times. And a lot of kids post-COVID, they just didn't have the best coping skills, and nor did the adults, including myself. Why suicide prevention is so important now more than ever? Why would you say that?
I would say it's really important now because we're taking a greater look at mental health,
yes.
not only with youth, but with adults, and putting a greater emphasis on taking care of ourselves so we can take care of others. And so for us, it's really important that we go out into the community and do outreach and education. I do know the science trainings to help people understand the warning signs for suicide, how to have conversations with people we care about, and then how to connect them to resources. And then we provide other mental health and suicide prevention resources as well.
So your suicide prevention coordinator job, your role is across the community, including the youth.
Yes.
But also people that are adulting but that are hurting.
Yeah.
And really great. I mean, those are such important roles, Corinne. My goodness. And then you said something else with your role. What is your other role with public health? My goodness. Did you have,
I think I just had the two.
Okay.
Yeah.
It just seemed like a lot.
It does
so I
seem
was
like a lot.
Is there more? Okay. And so tell us a little bit about how you came to be these roles, these such a crucial, important roles for our community through public health.
Yeah.
Like what's your certification or background?
Yeah, so I have a bachelor's in science and health science from San Jose State University, and I switched my major from nursing to work in the public health field because I really enjoyed community health, helping people, and really working with communities. That was a huge part of it. And I've been working in public health for close to 8 years now.
Wow.
Not in other counties and not just Nevada County. So that's kind of how I got here.
Well, we're so lucky to have you. What is like if someone was interested in getting some help in public health, because it is a community organization, how could they get in touch with you if they are hurting, or they know someone who's hurting, or someone who's on the verge of suicide or homelessness, or a young person who needs help?
Yeah, we are launching a new campaign called Mental Health Matters Nevada County in collaboration with Nevada County Public Health, Nevada County Behavioral Health, and our community partners. It launches tomorrow for Mental Health Awareness Month.
Great.
And it is a campaign that's focusing on increasing awareness about mental health and suicide prevention services, as well as access and understanding those services. Everything is located in one central hub, mentalhealthmattersnc.com or MHMNC.com, where we have information on getting help. So it outlines all of our crisis response resources, including in-person, text, chat, calling services, as well as general information about how to get help. So breaking down behavioral health services for adults and children, how to access services if you have private insurance, or if you have no insurance or other low-cost options. We also have a general resources page that talks about how to take care of ourselves, how to take care of others, information on our community supports, like our Mental Health Matters Nevada County Coalition, as well as information around outreach, education, and other educational videos.
Wow.
And
Wow.
yes, a wealth of information on our website.
So I'm going to have you repeat it one more time. It's Mental Health Matters.
Yep, Mental Health Matters Nevada County is the campaign, and mentalhealthmattersnc.com is our website.
Okay, mentalhealthmattersnc.com. Fantastic. What an incredible... Do you do this every year? Is this a campaign that you do every year, or is it just special because of our needs this year?
We don't do it every year. We thought that we needed we had a need for a greater mental health resource for the community, and have these resources and services all in one place for easy access, and also to help destigmatize mental health and getting help.
Absolutely.
And so it's all there for everyone, one central hub now, and we hope that you guys can use it and are able to use it and can help yourself or help someone else.
Well, and that's the thing. It may not be me, but like I have a niece who I am worried about, and I'm like, I need to get her some help. And so mentalhealthmattersnc.com is where you can go. And isn't it true, the statistics say that through our lifetime, 1 in 4 of us need mental health support? Would you say that that's a correct statistic? Through our lifetime, there might be 1 in 4 of us
I would say that's pretty accurate. A lot of the times we need mental health. We need support, and whether that's from the community or from another person. And so having the resources available, not only to take care of ourselves, but how to take care of others is super crucial.
Well, thank you so much, Corinne, for being here. And don't go away. We'll be right back with our next guest.